and there he comes, the real. You have the floor, Don, giving us your report on the immunization distribution.
Well, thank you, Mr. Chairman and members of the board. I appreciate the chance to go over how we're doing on vaccine distribution. So I'm going to give you a couple of numbers here. I'm sure you'll have some questions which I look forward to answering for you as well. As of Tuesday night, Panhandle Health District has been the conduit of distributing 13,435 first doses of the vaccine, and that's a mixture between the Moderna and the Pfizer. We've also distributed 3,260 second doses of the same product. Just to give you a little understanding here, the state receives roughly 20,000 doses a week. And then from there, that's distributed to these 7 health districts. Over the last 3 weeks, we have averaged 2,750 doses per week that we've gotten from the state. You know, of that 13,435, Panhandle Health District has administered 30% of those doses, or 4,125. The rest has been our other 15 partners that we have, enrolled providers that are administering that vaccine, which is very helpful, and they're scattered all over the 5 counties here in Idaho, or excuse me, in District 1. One of our we have 2 responsibilities as a health district. One, we are essentially the gatekeeper for these. They come to us and then we distribute. We also want to make it very clear that we're evenly distributing these vaccines across our 5 counties based on population, and that's what we're doing currently. And so to give you some idea, if we were to receive around 2,700 doses, that would break down to 1,780 to Kootenai, 500 to Bonner, 140 to Boundary, and 140 to Shoshone, and then 110 to Benoit County. Where we have moved through our phases, as the governor has asked us to do. We move through our healthcare personnel, and then through our schools, teachers and staff, critical infrastructure, first responders. And we have a few of those that still are trickling through the process. But now comes the big task, and that starts on Monday, and that's distributing the vaccine to our 65 years old and older. That is a challenge, and we could not do this without our many partners throughout the health district. If you think about that just for a moment, again, with those that are in long-term care facilities, and that would be skilled nursing facilities or assisted living facilities, there is a federal pharmacy program in which Walgreens is taking care of that. They are going in and vaccinating patients and staff, which we are most grateful for. But you take out that population, there still remains over 51,000 individuals that are in that age group of 65 and older. If we estimate, look at a percentage of how many of those choose to be vaccinated, by the current vaccine flow that we're getting, around that 2,700, it'll take us 7 to 9 weeks to get through that population. And so again, it'll take a while. And then we'll move into our essential workers, like our grocery and manufacturing. And then after that will be the general public that will be open to be vaccinated. We did get some good news this morning, however. Each week we get a notice from the state of what our allotment will be the following week. And as I mentioned, that's been around 2,700 for the last 3 weeks. The allotment that I saw early this morning was 3,850 doses. I immediately contacted the state director of vaccinations, who we get the letter from, and she indicated that that would be consistent, that we would be getting around 3,850 to 4,000 doses a week. That will significantly help our ability to get this vaccine out quicker. Clearly, I want to also make it clear that we do not hold large amounts of vaccine in inventory. Our goal, and we've been able to live up to this, is the vaccine we get 1 week are in people's arms the next week. through work that PhD does, as well as our excellent partners out there. On that, I have put together all of these partners. There is 11 of us that are regularly administering the vaccine. We have others that need it sporadically, which of course we honor. And we meet once or twice a week. And that group makes the decision on two things primarily: how the vaccine will be distributed, and ensuring that we're following the governor's plan of a phased approach of vaccination. That has been a tremendous help in making this a group effort. This is not a sole decision made by the health district. It is the health district and our many partners that are making that decision. So, for example, we're meeting again tonight, and we have two goals: to talk about what our messaging looks like for the 65 and older. We want to all be on the same page in what we're telling the public. There's been, honestly, a lot of confusion with that. And secondly, how we are going to allot these additional doses that we've received. And we'll have that discussion. So we're very hopeful that tomorrow you will see on Panhandle Health District's website these various locations throughout the 5 counties where people can go to become vaccinated. But as you can imagine, all 51,000 are going to want to be vaccinated next week. And so we're just encouraging the public to be patient with this extra allotment. And if it continues, we'll be able to be done with this in 5 weeks. So we hope that that continues. But I know it's been frustrating to the public. It's been frustrating to us. And but we think we're in a good plan now. We've moved nicely through the phases, as I've mentioned, and now comes a challenge for us. But our partners are in place. The only thing that would change the dynamic is if we got more vaccine. So that's essentially my update of where we're headed with this, what we've done so far, and where we're going. Are there some questions that I could answer for you?
Mr. Chairman.
Yeah. Glenn? No, did I see somebody up here? Dr. McClandress will take your question now, and then Glenn.
More just to make a comment. I'm on this committee representing the board, and watching Don do his work. I want to compliment you, Don. You are a fantastic leader in a group. Everybody in that group has their own population that they're caring about, and I want to just compliment you on how well you're doing in managing a big challenge. The ethics of how to distribute a limited supply are certainly going much more smoothly because you're managing it so well. So thank you very much.
Appreciate that. Thank you.
All right, Glenn?
Thank you, Mr. Chairman. Don, my question is out of curiosity. The vaccine we're receiving, from which manufacturer? Is it 90% effective or the 95% effective?
We are getting it from both manufacturers, and actually we don't know until we get that letter what it's going to be. It could be 950 of Moderna and 2,000 of Pfizer, and then it could flip the following week, which is a little bit of a challenge because, as you know, there's some care and monitor of that that's different. So that's another great reason that we meet a couple of times a week with this group. We can let them know so that'll help them. When they know what's coming, it determines what they ask for their allotment.
Mr. Chairman?
So in the distribution, those that have received the first dose, do they then have priority to receive their second dose over those who have not yet received it?
What happens is what I have spoken about in numbers, when I talk about the 33,850, I'm only speaking of the first dose. We automatically receive the second dose. That comes automatically. So, either 3 weeks or 4 weeks later, depending upon what manufacturer it is. So that is guaranteed that those will receive it. Most of our providers are using a scheduling system that when they come in for their first dose, they are scheduled that day for their second dose, and they are guaranteed to come in for that. So you don't need to worry about, is there going to be enough around to get my second dose? So far, that's been guaranteed.
It's good plan. Thanks for the clarification.
You bet.
Okay, Laura?
Hi, thank you, Mr. Chairman. Just, Glenn, just a point of trials of both the Pfizer and Moderna, 2 weeks after the second dose. They're both pretty comparable for the clinical trials in providing immunity in the 94, 95 percentile versus the 90.
Okay, any other questions?
Just one, Mr. Chairman.
Yes.
Yeah, Don, do you have any evidence that this actually prevents COVID infection or a different result on a PCR test?
I do not. I mean, we can only go back to the research that's been done. And also, people have asked me, are our numbers changing because of the vaccine? We've only got about roughly 2,000 individuals that have received both doses and waited the 2 weeks after they got it. So we don't have enough to know what a long-term effect it's having in our community. So we're relying on the research that's been done in the past, but to specifically ask your question, I haven't done research on that.
Yeah, my understanding, when they say it's 90% effective, what they mean is that 90% of the time, 50% of the people that were injected showed a rise in an antibody type within their test period. So 90% of the time, it's 50% effective at raising an antibody within 2 weeks or whatever it is. But there was no testing, as near as I could tell, to find out whether it prevented infection or prevented a change in test or anything like that.
Gotcha.
Mr. Chairman?
Yes,
Um,
Laura?
It looks like Dr. Yao might have some information on that, if the board would be interested in hearing from our virologist.
Yeah, I actually have a slide that explains how the 95% efficacy was calculated. Let me pull that up and I can share that screen with you guys.
Are you okay with that, Mr. Chairman?
Yes.
Okay, give me a minute to bring that up.
All right, go ahead. Do you have anything else, Karen, to?
Yeah, she's pulling up the slide.
Oh, okay.
So here's actually an epidemiology slide that I made for Jeff because he's our lead epidemiologist. But this explains where we got the 95% efficacy numbers from. We actually got it from clinical trials that were done to study the efficacy and safety of the vaccines. So basically what they did was they gave the vaccines to participants, randomized these participants, compare them to placebo groups, and after at least two weeks after the second dose, they start following the participant and did calculation comparison to see how many people who've been vaccinated and got COVID and how many people who were in the unvaccinated placebo groups got COVID. So here's an example from the Pfizer trial that show that in the group, out of the 22,000 people that were vaccinated, only 8 people came down with COVID when they followed these participants in the study. But 162 people that were in the placebo group actually came down with COVID when they analyzed the result. And so the 95% efficacy
thank you. Any other questions? If there are no other questions, Dawn, thank you for that report.